Welcome to Future Forward Nurse Practitioner, Career Development and Growth Series. In this episode, we will examine the pros and cons of the NP role, core specializations, what drives compensation, and the factors that influence work-life balance. We will also touch emerging clinical trends. Let's connect the dots and set the stage for the spectrum of NP paths, from primary care to psychiatry to acute care, so you can spot your best fit. NPs mix autonomy with collaboration across clinics, hospitals, and telehealth, spanning primary, acute, psych, women's health, geriatrics, neonatal, and anesthesia. Compensation is based on region, setting, shifts, certifications. Work-life balance is dependent on schedule, panel, call, documentation, team support. Psych mental health NPs assess, diagnose, and treat across the lifespan, combining therapy, medication management, and crisis support. The draw is meaningful therapeutic relationships, strong demand, and flexible telehealth that can expand access. However, the work is emotionally intense, boundaries require vigilance, and medication management can be complex and nuanced. Compensation is generally competitive, shaped by demand and payer mix, while trends favor telepsychiatry. Settings range from inpatient to private practice and virtual clinics. Work life improves with thoughtful caseloads, supervision, and recovery routines. Schedules often mix clinic days with optional teledays. Billing, supervision, and prescribing authority vary by state and payer, so local policy shapes both workflow and earning potential. Hiring is rising in integrated behavioral health within primary care, roles that reward coordinated care, panel outcomes, and patient engagement. Family and primary care NPs span preventive, acute, and chronic care across ages, serving as a trusted first contact for most health needs. Positives include continuity, broad skill use, and community impact. Challenges include heavy documentation, variable pace, and pressure to manage large panels while maintaining access. Compensation varies by region, productivity, and payer mix, and trends point to protocol-driven care in urgent care and employer clinics. Daily work spans triage, education, procedures, and coordination. Markets vary with regional demand and system consolidation, so local networks and versatility keep you competitive. Schedules are often weekday-centered with occasional evenings or weekends. Continuing education in chronic care, procedures, and digital tools elevates value. Acute and critical care NPs stabilize high-acuity patients in ICUs and step-downs. The upside is advanced procedures, tight teamwork, and the potential for premium differentials tied to acuity and shifts. The trade-offs: high stress, rapid clinical turns, and cognitive physical fatigue. Collaboration with intensivists, RT, pharmacy, and nursing is constant and is the safety net. Schedules often include nights, weekends, and holidays, with pay reflecting off-hours coverage and unit needs. Debriefing, mentorship, and deliberate self-care are essential to sustain performance and reduce burnout risk. Expect inpatient workflows with consults and follow-ups varying by service line and staffing models. Trends include APP-led rapid response and tele-ICU coverage, with compensation typically premium where acuity and coverage are highest. Adult gerontology NPs navigate complex older adults across homes, clinics, hospitals, and SNFs. Advantages include meaningful continuity, autonomy in community settings, and strong interdisciplinary impact. Challenges center on rising acuity, polypharmacy, and caregiver dynamics that complicate care plans. Predictable rounds, clear communication, and tight coordination keep clinics and SNFs running on time. Medication reconciliation and deprescribing are daily disciplines that reduce harm and hospitalizations. Palliative and hospice skills support comfort, values-based decisions, and smoother transitions. Compensation is generally competitive. CRNAs deliver anesthesia and airway management for procedures. The appeal is high responsibility, technical mastery, and typically premium compensation reflecting expertise and risk. Trade-offs include high stakes, intense focus, and call variability that can stretch stamina. The path requires additional graduate training with rigorous clinical immersion and competency milestones. Practice authority differs by state and facility governance, shaping autonomy and case mix. Most programs run 2 to 3 years in cohorts. Women's health NPs provide reproductive, prenatal, and preventive care, guiding patients through key life stages. Benefits include longitudinal relationships and purpose-driven practice. Challenges involve emotionally charged encounters, policy advocacy, and variable on-call expectations. Recurring check-ins through pregnancy and postpartum sustain safety, confidence, and continuity. Compared with FNP, scope narrows while depth in reproductive care, procedures, and protocols become more specialized. Jobs cluster in metro areas, with rural incentives and loan aid possible. Compensation varies by setting, volume, and privileges. Overlap with OB teams depends on privileges, protocols, and site culture, and often shapes call and schedule. Neonatal NPs manage fragile newborns in NICUs. The rewards are life-saving impact, advanced monitoring, and tight high-functioning teams. The demands are high acuity, meticulous procedures, and constant vigilance over rapid change. Advanced credentials and experience open doors in tertiary centers and specialized units. Schedules routinely include nights and holidays to maintain 24/7 coverage for fragile patients. Hiring favors fellowships or prior NICU RN experience. Postings may be limited, with compensation competitive to premium in high-acuity centers. Every NP path has its own rhythm. Success comes from aligning your strengths, lifestyle, and values with the role that fits. Start by checking state practice rules, talking with mentors, and check out the various settings. Track skills for telehealth, integrated behavioral health, value-based care, and APP-led teams. Follow an advanced practice for more nurse practitioners updates.